Our system of healthcare here in America isn't only costly, it's also evil. From prioritizing profit over care and denial of care to pushing patients to the curb. That's what I'm talking about in this video. And no, there is no beauty to be found here. The healthcare industry is huge, with a value of over $4.9 trillion and making $491 billion in profits alone in 2024. The healthcare industry is also the largest employment sector in America, employing over 17 million workers. And the healthcare industry serves over 1 billion people every year. And yeah, you too are included in that number. Like I said, the healthcare industry, it's a monster. And when you're as big as God and got the powers of God, well, you also got to have an evil side. Because that is how God, the real God, created shit. From denying care to pushing patients to the curb because they can't afford the cost of a hospital stay. And since our health industry is also a business, there's a profit that needs to be made, and like every business, there are times a hospital has to cut costs. And one way to cut costs is to reduce staffing ratios. That leads to longer wait times and increased workloads, and of course, when you're picking up the slack and ain't got no help, well, you're probably liable to make a mistake or two. Of course, cost cutting isn't necessarily evil, but patient dumping is. And patient dumping is when a hospital discharges a patient, kicking the patient literally into the streets even before they're medically cleared to be discharged. Why, might you wonder, would a hospital do such an evil thing? There are several reasons for patient dumping: inability to pay, overcrowding, or perhaps they needed extended care outside of a hospital, or perhaps there's just nowhere for a patient to go. So they take the easy way out and just dump them out onto the streets. In Baltimore, they discharged some woman who was wearing nothing but a nursing gown, and they wheeled her out in a wheelchair to a bus stop in freezing rain, and apparently left her there. In Louisville, they left an old woman who had shitted herself on the sidewalk, and to make matters worse, the shit froze 'cause it was friggin' freezing outside. And of course, when it comes to dumping patients out on the streets, the elderly and the mentally ill are those most at risk. As I said earlier, ain't nothing wrong with wanting to make a profit, but I gotta ask you, is there a line that shouldn't be crossed? I get cutting staff and outsourcing shit to third parties, and I even understand prioritizing the care of the insured over those who are not insured. But come on, there's some shit you just don't do. Shit like dumping people out on the street or denying someone care, especially someone who has health insurance. Because that trend, denying people medical services even when they're paying outrageous healthcare premiums, that trend is becoming prevalent. And right now, about 20% of all requested medical procedures are denied. And the rate of denials for shit you need to stay healthy is rising every year due to a lot of things. Things like the introduction of artificial intelligence to review claims, stricter requirements that need to be met, mistakes being made, and when it comes to medications, well, medications that were once covered by your insurance plan maybe no longer are covered. Leastways, that is what the industry tells us why they might deny the need for your open heart surgery. But you and I, we know the truth, and it's to make a buck, to increase their profit margin. And among some of the most denied services are those for mental health. And yeah, scratch your old noggin over that one. But wanting to make a quick buck isn't illegal. Never has been and never will be. But one should ask, when does making a buck become wrong? When a person dies from a lack of care, or when they're pushed to the curb in the dead of winter? And that's how we're going to finish up this video, with the corruption that is inherent in our healthcare industry. And there's a god-awful lot of corruption in the healthcare industry, and that's because kicking people to the curb while they are still sick is profitable, reaping in anywhere from 100 billion to as much as 300 billion. And almost all that is due to fraud in billing and kickbacks and pricing. And no, your politicians ain't going to do anything about it. And that's because they are a large part of the problem. I mean, how else would you attribute the healthcare industry spending over $650 million to buy those politicians last year alone? From pharmaceuticals to equipment manufacturers with the hospitals thrown in. That's what the healthcare paid out to politicians so that they could deny service to your mom or dad or better half who's maybe dying of cancer. And the only way to end this video really is with one word: shameful. The healthcare, American healthcare. And when I think of healthcare here in America, I could probably drink a whole bottle. Like I said, a whole bottle of tequila. I should glue my dentures when I do these, but I don't because I don't know. I'm not a professional. Okay. Healthcare, it is evil. In this country, healthcare is evil. I'm not saying doctors are evil. I'm not saying nurses are evil, although my wife is an LPN and sometimes I ain't going there, but for the most part, it's not the people that work in the field that are evil. It's the people, the health insurance providers, the administrators, the people who have all the control. And above all that, it is our politicians. Our politicians are just fucking horrendous when it comes. The problem with healthcare in this country will never ever be solved. It's broken beyond repair, and it's because of the way the political system is set up. Just that is the honest to God, harsh truth. You might as well start over. But then if you had politicians starting over, they'd still find a way to fuck us over, wouldn't they? So I don't know what the answer is, but I do know this. It's going to get a hell of a lot worse before it gets any better. Peace out, my friends. Have a good one.